Hi, I'm Arindam Sen, founder, director, and CEO of Heartnet India Private Limited. Cardiovascular disease, we are seeing very rapid rise globally and also within India, and it has become one of the highest mortality factor in the country right now. Earlier, we've seen infectious disease, road accident as top mortalities, but as we progressing now, we see cardiovascular disease taking the place. It is going beyond the urban, going beyond the high age group, what we used to talk earlier, 50 plus, 60 plus age in an urban rich environment. But we see the incidence now happening even in the rural, semi-rural background at a very lower age bracket also. With the rising incidence of the disease, the main challenge what we see is late diagnosis, and that can be prevented with early screening and early diagnosis beyond the hospitals, beyond the periphery of the urban area, and creating access to care even at the remote locations. Now we can look at having cardiac specialty clinic at every places of the country, but that may not be a viable proposition because number of cardiologists and number of people in remote locations will never be able to match up. Now how do we do that then? That brings the next question, and we have seen a lot of technology initiative to create the teleconsultation care, telemedicine. All these things has been progressing over the years, and post COVID we have seen acceptability of remote consultation has become much more. Now in that scenario, if we can take a cardiologist service remotely to a rural area with the help of technology and the supporting infrastructure, that probably will create the infrastructure required for early screening and diagnosis, which can slow down the rise of cardiovascular incidence in the country. Coming to the solution that we have been developing and we have developed now, we are going to the market with that. Essentially, it has four components. One component is the patient touch. So we are not eliminating the patient touch with a physician or with a paramedic or with a technician. So there is essentially a person who talks to the patient, gathers the technical data and gathers the clinical parameters from the patient using our IoT box called Asan. Asan is very easy to use IoT box which can be used by any paramedic, any technician in a one-day training. It also comes with a lot of built-in parameter collection methods, and also it has option to add manually parameters from outside. So once the physician or the technician or the paramedic collects all the data as per the defined protocol which is required for a proper cardiac screening, it connects to our cloud server. Cloud server processes the data, create the risk assessment and sends the complete profile of the patient along with the risk factors to our panel of cardiologists. Panel of cardiologists gets an alert moment a new screening is done. They open their application, see the patient profile and see the data and gives the opinion. He may or may not accept what system has prompted. He can delete the whole opinion of the system, write down a new complete opinion and send the opinion back to the origin where from the patient data has been originated. Heartnet as a organization, as a company, started with own funding by the founders, and we put enough resource into it to get it to the market. Now we have been looking for some external funding to scale it up for market entry, and we see quite positive response from tech savvy investors, and we are hopeful that we will be able to close that very soon to increase our market activity. In future, there are two things we are looking at. One is obviously enhancing the technology platform, adding more clinical relevance to the whole solutions so that it becomes a complete cardiac screening. Today we have a screening to a basic level where we find a risk, patient might have to be referred to a high-end diagnostic center. We want to go one step further so that any doubts at the initial level can also be clarified with the solution. So we are enhancing on the R&D activity and collaborations with different tech companies in India and abroad to include those features into the system. On cloud side, we are also enhancing our data computing capability and getting Gen AI solutions so that we increase the productivity of the cardiologist further. On the cardiologist end, we are implementing solutions which will help cardiologists to look at the data in a much faster way. So these are the three ways we'll enhance the technology, and we are committed to invest more on technology enhancement in future days to take the solution to bigger markets in a lower cost. Primarily, we are operating in India right now, but we see similar opportunity exist in Southeast Asian countries. We see opportunities increase in the Gulf countries. So we have been talk with the partners, possible partnership opportunity in ASEAN and GCC for our future expansion. In India, we have started rolling out the solutions, couple of parts. We have not gone too thin to cover the whole India in one day. We are operating very strongly in the east, south and west, couple of states. We are operating in 6 states right now, and soon we will be covering more states with higher population within next 12 months time.